Well, good morning and happy 4th of July weekend. Welcome to Elite Care Surgical Specialists. I'm Dr. Zahiri, or Dr. Z as most of my patients know me. I wanted to talk to you this morning about abdominal wall bulging. It is one of the common diseases that we encounter in our practice and that patients come to us for. And it is often anxiety provoking for patients when they find bulges on their abdominal wall. Now, I will begin by saying that there are obviously many etiologies for bulging of the abdominal wall. And some of those common etiologies include hernias. Sometimes individuals have masses underneath the skin on the abdominal wall. And other times, the abdominal wall might be weakened from prior disease, from prior trauma, which can cause the abdominal wall to bulge out. And today I wanted to talk a little bit about the abdominal wall bulging secondary to essentially wear and tear on the abdominal wall, one of the common things that we see. This lovely young lady came to our clinic, had a very, very full life, and is very, very motivated to function and look well. She's actually had 5 children, which is a tremendous amount of work. Both during the pregnancy and after. And as a result of those pregnancies, she developed this midline bulging of the abdominal wall, and she was not sure what this was. However, as you can see, by its dramatic nature, it caused her a lot of anxiety and concern. And she presented to an outside surgeon practice who also was not an expert in this area, and essentially informed the patient that there was not much to do about it, and jokingly, I guess, had mentioned something to the effect that try for it not to burst or something like that, and it had led to a lot of anxiety for the patient. When she came and saw me, she was actually well known to me previously. I had taken care of her. I was able to immediately do an assessment with her and fortunately rest her mind to ease and informed her that really what she had was 2 things going on. One was that periumbilical area hernia, and it was also associated with what is called diastasis recti, or separation of the abdominal wall muscles. And the muscles of the abdominal wall separate from each other from wear and tear. So for example, pregnancies, one of the more common things, and women often find that after pregnancy, that they deliver, especially after several pregnancies, that they can have midline abdominal wall bulging. And that generally involves the upper midline, but it can extend all the way down to the lower midline, around the navel, and obviously below the navel if it's severe enough. And it is not a threat often to someone's well-being or life, but can cause a significant amount of symptoms, including abdominal wall weakness, abdominal wall pain, and often what I've heard from my patients is that they've had difficulty doing core exercises or activities that require a strong core. So for example, a sit-up. I previously had a police officer, and she had gone through the academy, and she had severe diastasis, separation of the muscles, and was having difficulty functioning. And in this case, it was not only symptomatically causing her discomfort, but she did not like the way it looked and appeared. Now, I'm going to distinguish between 2 things here. We talked about the bulging and that separation of the abdominal wall muscles. So how is that different than a hernia? Well, a hernia is a hole in the abdominal wall fascia layer. So it is essentially, for lack of a better term, a hole that things can poke through. Whereas bulging and separation of the muscles is not necessarily a hole in the abdominal wall, but is essentially weakening of the abdominal wall, which allows the abdominal wall to essentially protrude out. Now, this is what I would consider a clinically significant version of this disease. There are individuals who have some separation of the abdominal wall muscles, diastasis as a function of, or as a result of a long life, functional life. And this can happen in men, it can happen in women, and we don't always recommend surgery in these cases. However, in this particular case, this was obviously a case that warranted what we do here, which is robotic abdominal wall reconstruction, to bring back the abdominal wall muscles together, fix the hernia disease, and kind of restore not only that anatomy of the abdominal wall, but hopefully the function of the abdominal wall. Now, the second lady that came and saw, she's also a lovely young lady, and she has had one child and very, very much in shape and takes great care of her body and looks terrific. But after her first pregnancy had developed similarly, not only a periumbilical hernia, but a diastasis recti, or separation of the muscles that extended all the way up to, from her navel all the way up to kind of the chest wall area. And the difference in this particular case, which made her unique compared to the first case, was that she is still planning to have more children. The first patient I showed you was not planning to have more children. She was done. So she was essentially ready for surgery. Whereas this young lady was still planning to have at least one more child in the next year. And one of the important things to note is we don't generally want to perform any kind of abdominal wall reconstruction on anyone, especially on an elective basis, when they're still planning to have children in the future. So in this particular second case, while the assessment was the same, that she had a periumbilical hernia and bulging of the abdominal wall consistent with diastasis recti, and that she would benefit from minimally invasive robotic abdominal wall reconstruction, the timing of the surgery would have to be done in a way that would give her maximum opportunity to obviously go through pregnancies, have her children, and then come back when she's ready and done with pregnancies and having children, so that we could essentially once and for all correct her abdominal wall anatomy. Correcting the abdominal wall anatomy before the pregnancies are completed, it means that in her future pregnancy, if I was to just do this surgery next week, fix her abdominal wall, do a robotic abdominal wall reconstruction, and she went on to become pregnant, it could cause her issues during her pregnancies, including significant abdominal pain, abdominal wall pain, and abdominal pain as that baby is growing and pushing on the abdominal wall. Our repair, which has kind of brought the muscles back together and tightened it, doesn't afford that compliance and that ability of the abdominal wall to stretch and accommodate the baby. So we always want to be very careful when we do surgery and who we want to do surgery on. But really, the empowerment of the patient is key here, and that's giving them the knowledge so that they do not have anxiety, they do not have fear. And so I wanted to share these two cases with you. I will be following up with my post-surgery video, which will show how things look during the first week, during the first 4 to 6 weeks after surgery, at 6 months, at 1 year, at 2 years. We'll include some CT scans before and after surgery so you can see. But if you or someone that you know has abdominal wall bulging and needs to be seen, please refer them to Elite Care Surgical Specialists. We will be happy to provide them expert care and alleviate their anxiety and come up with a game plan, a surgical plan that fits them and fits their lifestyle. And I've no doubt that we will earn their confidence and their trust. Appreciate your time with us today. Have a great weekend.